Hello, how are you? Hope everyone is alright. I've tried numerous times this week to record a video talking a little bit about the ADHD medication that I've been prescribed, Concerta, but nothing I've done has been good enough, even for my low standards. So I haven't done it. I've actually this morning taken delivery of it. It didn't come till about 11 o'clock, so it's too late in the day for me to take it. You need to take it first thing in the morning. So Concerta hopefully will help me concentrate or turn off the chaos symphony that is constantly in my head. It is the brand name of a stimulant drug called methylphenidate, which is also within Ritalin. But my understanding is the Conerta has a different delivery system, so it's a slow release medication, and you take it first thing in the morning with food. And I don't often have breakfast, so I'm going to have to make myself. And within an hour or so, give or take, 22% of the methylphenidate gets released into your system, and then throughout the course of the next 8 to 12 hours or so, through a microscopic hole that is laser created in the capsule, the rest of the methylphenidate is drip fed into your system. So what methylphenidate does is it inhibits the reuptake of dopamine and noradrenaline, so two neurotransmitters, hormones, and simply put, what that means is people like myself, when dopamine is the transmitters fired off in the synapses, what tends to happen is, and also with the noradrenaline, is when it gets to the other side, it's basically all hoovered up and binned off, so it doesn't stay within our system, which is why we find it hard to focus, to concentrate, to focus on one thing, and while we can find it difficult to be motivated. So the methylphenidate inhibits that process, and so it should calm the heat down. And I've seen reports where people say that they feel more confident on it, and I'll be interested in finding out what it's going to be like for me. There are some side effects that may or may not happen. So the first one is it can upset your tummy, which is why you have to take it with food, but it's something just to keep an eye on, certainly for the first few days, is my understanding. And it may for a couple of days increase anxiety, and it may increase irritability. So that's something else that I'll need to be aware of, just in case. Hopefully it won't. I've got my reasons for thinking that it won't. But yeah, you have to be very careful with caffeine on it, because caffeine is also a stimulant, so it can it can cause issues. They don't say don't drink caffeine. They do say just be careful. So I've been weaning myself down this week. I usually have 3 pretty large mugs before I go to work of coffee. I've knocked that down to 2, even 1 some days in preparation. You also have to be very careful around alcohol, because it can interact with that. It can spike your blood pressure. It can also inhibit the feeling of the effects of alcohol, so that people don't realise how much they've had and just keep going. So that's basically, it's not recommended that you imbibe alcohol whilst the drug is in your system, leaving it at least 12 hours after taking it. The one that concerns me the very most is it may affect sleep. Although, having looked into this, as I tend to do, that seems to be where people have taken it too late in the day. They've forgotten to take it in the morning, because that's what we do. And I've no doubt at some point I will forget. That's not pessimistic, it's realistic. And then they've taken it too late in the day, and then they have struggled with their sleep. that seems to be where when that happens. So hopefully that won't happen to me. I've worked very hard over the years to get into a good sleep routine, and that's probably the least that's the one I'm least looking forward to if I get any of the side effects. So I'm on a period known as titration at the moment, and this is where they're trying me on different doses. So it's 18 milligrams for the first 7 days. Then after that I'm taking 36 milligrams. They may, depending on how I get on with them, they may change the dosage. They may potentially try me on different medication. We just have to wait and see how I get on over the next week or so. So why give ADHDers who are hyperactive, at least in their heads, and many ADHDers are hyperactive externally, swinging off the light fittings and all the rest of it, why give us a stimulant? Because it balances out the dopamine. So that's we lack that, and the noradrenaline. It balances that out, so it should make things a bit calmer in the chaos engine that is behind the bone on the top of my shoulders. So I am looking forward to trying it. There was one weird sort of concern I had that I quickly put to bed, because I know that's not the case, and that was, it might change my personality. It's not what it's for. That's not what it does. It simply should calm things down while it is in my system, allow me to focus on what I need to focus on, so that I'm not as tired at the end of each particularly working day, because I get a huge crash around about 7:30 in the evening after work. Always have done, and it's why school was so difficult and found me usually looking out the window, let's face it. So it won't change my personality, but my head went there, and apparently that's a very common thing that people feel. And then I realised I felt the same way before I started therapy, and it's not the case. So that's all good. So I will do one on waiting mode, because I've been in waiting mode since last Friday the 17th, for the meds to be delivered, and I'll do one on pain. So I actually bit the bullet this week. I went to see an osteopath yesterday because it's been the 4th week of my back. I don't need your ego stroking, and I've now missed out on 2 days of overtime because of it. I was thinking the week before this one just gone, I won't do overtime on Friday. Maybe I'll do a couple of hours. That decision was taken out of my hands, because they know what I'm like at work. I tend just to try and get on with it, and they told me that, till your back's sorted, mate, you can't do it. You're not doing yourself any favours. So the reason I didn't look into an osteopath or a chiropractor was cost, and I've lost 2 days overtime. So this week I bit the bullet and went, and whilst it is not fixed, it has helped massively. And it's just proof again that if you're struggling with something, be it physical or mental, you have to reach out. You have to hold your hand up and say, I need a hand here. The osteopath was never going to phone me up and say, hey Pete, I've heard you've got a bad back, why don't you come in? It doesn't work like that, does it? No help's coming unless you ask. Simple. So it's considerably better today. As I say, not fixed, well worth the money, and hopefully over the next few days it will settle down even further. So don't be stubborn, Pete, and just try and get on with it for 4 fucking weeks, because it's been a very unpleasant 4 weeks of work. Trust me, it's not been very nice. So if you're struggling, you've got to reach out. Yeah, no help's coming unless you ask. And it's not weakness, it's strength when you hold your hand up. Okay, and then you'll find that things improve. Right, that will do for today. I'll get this uploaded here, there and everywhere. I brought my power bank out with me, so I can do that this afternoon. Yeah, so enjoy Saturday. It's sunny where you are. Enjoy it. Get out in nature. It's really good for your mental health, mental wealth, as Bob Sheldrake says. Good for the noggin, and it's just nice. And there's very few people in the fields today, which makes it even better. There you go. Take care. See you later.